Healthcare providers have a lot going on. They have to keep costs down, see more patients, and keep up with all the new medical advances. And that's no small feat. We have treatments and operations available now that wouldn't have been remotely possible just a few decades ago. Things like statins to treat high cholesterol, targeted cancer therapies, and bionic limbs are revolutionizing patient care. However, in this push for the latest and greatest, it seems that healthcare providers are often forgetting the basics by making simple mistakes that end up costing far too many dollars and lives. For example, improvements in surgical methods allowed over 2,200 heart transplants to be performed in the US last year. With this number, the US has become the international leader in transplant surgeries, and with almost a 90% one-year survival rate, this is incredible. But this is nearly the same number as the surgeries that were performed on the wrong site. This includes mistakes such as removing the wrong kidney, performing the wrong operation, or operating on the wrong patient. The lowest estimates state that over 98,000 people a year die because of mistakes in hospitals, but they could be as high as 440,000. This would place medical errors as the third leading cause of death in the United States, behind heart disease and cancer, but ahead of stroke, Alzheimer's, diabetes, influenza, and pneumonia. We are human, we make mistakes, but there's no excuse for taking out the wrong kidney. There's no excuse for over 60% of healthcare workers not properly washing their hands before and after each patient encounter. There's no excuse when a patient who needed Prenexa, a prenatal vitamin, was instead given Pradaxa, an anticoagulant to prevent strokes. Safety should not be taken for granted, and actively pursuing quality improvement can make a huge difference. Let me give you an example. At UT Southwestern in 2012, it was noticed that there were 135 catheter-associated urinary tract infections across the hospitals. After having trained observers watch catheter placement, it was found that only 5 of 17 elements critical to proper catheter placement were consistently being followed. By standardizing procedures and training nurses, within just 1 year, catheter-associated UTIs were cut by 45%, saving an estimated $61,000. Nationally, hospital-acquired infections cost $30 billion a year and countless lives. We can stop these infections. We can stop these mistakes. Join the movement, because quality is everyone's responsibility.